Telehealth exploded during the COVID-19 pandemic, and the modality is here to stay. Some experts estimate that 30% of care will be delivered digitally going forward.
For successful telehealth consults, there are a lot of things to consider. First, it's important for a provider to have patience and creativity. You also have to consider things like your environment, the equipment setup, etiquette, and how you interact with patients. Here are a few tips. This assumes you or your practice have a telehealth platform in place, along with guidelines such as HIPAA, scheduling, charting, and etiquette.
Consider what's behind you. Blank, neutral-colored walls work best. Ensure there is no clutter or any distracting items behind you. Your surroundings should look professional. Also, avoid having windows or open doors behind you. Make sure you're in a well-lit room. It's best to have a light in front of you, like this one, that attaches by a suction cup to your computer or laptop, or an extra table lamp. Avoid positioning yourself with light coming in directly behind you, like from a window or lamp. Backlighting makes it difficult to see your face. First and foremost, always test your equipment before you start a telehealth session. Make sure your internet connection, microphone, and video are working. Like an in-office visit, good eye contact with your patient is important. Be sure to look into the camera while conducting the visit. You may need to raise the device so that the camera is at eye level. Use the self view to be sure you are positioned well on the screen. It is recommended that your image resemble a passport photo. If you're using a smartphone or tablet, it's best to use a stand to stabilize your device. Minimize sounds from others, including cell phones, children, and pets. It is always best to use headphones with a microphone to ensure patient privacy and clear audio during the visit. Even when working from home, you need to be in a private setting for your telehealth visits, away from others. If there's a chance someone might come into the room, put a Do Not Disturb sign on the door.
Social media has conditioned us to be very casual with our video interactions, but your appearance matters. Look professional during telehealth visits. Many providers wear a lab coat or scrubs, or whatever they would wear typically in an in-office visit. Limit loud, distracting patterns in your clothing and big noisy jewelry. And if you wear glasses, check for glare. You wouldn't eat or drink or answer emails during an in-office visit, so don't do those things on telehealth. How you begin and end telehealth visits sets the tone for the visit, so be mindful of these courtesies. Be sure to introduce yourself to the patient and have the patient introduce themselves to you. Confirm that they've consented for the visit, and at the start, be sure they can hear and see you okay. Speak clearly and wait a second or two after the patient speaks to be sure you don't accidentally interrupt them.
That is not uncommon at all after you have a stroke.
At the close of a telehealth visit, recap what you think is going on with the patient's health issue. Provide appropriate educational materials and any follow-up measures, like prescriptions, referrals, or next appointments. Be sure to give the patient an opportunity to ask any questions before thanking them and ending the session.
What questions do you have for me?
Nothing that I can think of